I'm going to introduce our first speakers. I say speakers because they're from the same institute. We have Gabriela Nasser, who is the director of the Instituto Melhores in Brazil, and Dr. Joyce Capelli, I hope I said that right, who is the president of the Instituto Melhores. They will be speaking about providing better nutrition and food security during the pandemic in Brazil. So Gabriela and Joyce, if you would like to introduce your topic and start your presentation. Thank you. And I will take questions at the end.
Okay. Thank you so much, Mai, for your, if I call it, for the introduction. I will share my screen now. Just a minute. Hope you can all see it. Yes, okay, good. So thank you again, as I said, for the introduction. Good afternoon to all participants. Hello to all those that are accompanying the conference from all over the world. It's a pleasure to be here and contribute to this discussion about innovation, technology, and sustainability, and represent a civil society organization among these higher institutions present here. We bring here to you today the results of a study developed by the Brazilian nonprofit Instituto Melhores on the effects of the pandemic on the food security of families in Brazil, as well as proposed interventions to alleviate this current scenario. First of all, I would like to briefly introduce the Instituto. It's a fully registered Brazilian nonprofit organization that has, for the past 25 years, contributed to the improvement of health, education, and well-being of children in several communities throughout the country. One of the main pillars of our mission and vision is that development comes with partnerships. It is necessary to work together with several instances, public, private, grassroots level, in order to achieve a positive outcome in sustainable development. We're also part of the Global Compact, which is a network of initiatives that work in accordance to the UN Sustainable Development Goals. And present with me here today is Dr. Joyce Capelli. She's president of the Instituto, or IMD as we call it, and we are happy to share some of our work with you. So the COVID-19 pandemic has had a clear effect worldwide. This has been intensely debated in the past months. A troubling factor about the effects of the pandemic in Brazil, not only there, of course, is that it has brought forth a fragility and vulnerability in terms of food security, health, and well-being, which go far beyond the 5.3 million recorded COVID cases. At the end of 2019, Brazil's working force was 40% informal and 16.2 million were unemployed. And aggravating the scenario, 85 million Brazilians had homes with some degree of food insecurity, of which 10 million suffered of severe food insecurity. Hunger is unfortunately once more growing in Brazil, despite successful efforts done in the early 2000s to remove Brazil from the World Hunger Map. Concomitant to the scenario, we have a current government in Brazil that is dismantling important institutions that were created in recent years to help change this reality. Now, when looking specifically at the malnutrition data in the country, 20% of the adult population suffers from obesity. In assessments done by the IMD Institute with school-aged children, an average of 14% of them are overweight or obese. This map with recent data demonstrates how Brazil is facing the double burden of malnutrition with high levels of overweight and obesity alongside iron deficiency anemia. Levels of anemia in children are as high as 55% in some areas of the country, which also show extreme inequalities internally that we find. So the actual extent of the effects of the pandemic in food security and hunger are difficult to assess at the moment and predict in the near future. Although it all indicates to an inflation of this current scenario of fragility and vulnerability. This, aligned with a political agenda that does not prioritize nutrition, social environmental policies, and family agriculture, creates an unstable environment prone to degradation, hunger, and further deepening crisis. So we developed an online assessment with the objective to detect the current impact of the COVID-19 pandemic on the food security of families in Brazil and provide possible local solutions to alleviate the current scenario. And now we share some of the results we found. In terms of economic impact, 64% of the families had their income decreased after beginning of the pandemic. And 37% of them are not working. And 1 in 5 of these families have no one in the household working as well. One main striking result is that 10% of the families currently don't have access to the food that they need. If we look regionally, local inequalities again are aggravated, and we have 18% suffering from food insecurity in the Northeast region, for example. 17% affirmed that their feeding practices got worse after the onset of the health crisis, and 12% stopped eating fruits and vegetables. The school meal is also being missed by a majority of the families. And in terms of health, 23% of the respondents mentioned they suffer from a non-communicable disease, and 2 in 5 families had someone in the household with a chronic condition. Now, these results demonstrate the urgency to implement long-term behavior change interventions for the population, since they are at risk of developing further complications worsened by the inadequate eating habits. Our experience shows that governments cannot address these multi-level factors by themselves. Therefore, civil society organizations have an important role to play, not only advocating for policy change, but delivering information and assistance to communities at a local grassroots level. So after schools were closed in Brazil in early 2020, because of the pandemic, and kids and families, as well as the teachers, had to stay home, it became evident that new strategies needed to be urgently put in place. A new challenge was present, which was how to reach families without internet, without access to technologies. Some of these things were brought up here today, the difficulties that many countries are facing in terms of how to deal with the lack of resources and internet access. And Brazil is a very unequal country, with each state having different socioeconomic and technological scenarios. So it's imperative to adapt and try to reach as best as possible those families that have no connection or unstable internet connection in order to bring information and continuous learning. We want to pay a tribute to all teachers in Brazil, as well as all over the world, who have during this difficult time dedicated themselves to changing their teaching methods, going beyond their usual experiences to reach the students. So the IMD Institute, after the pandemic, started reaching out to schools and teachers directly with education and health promotion, providing trainings and classes in different topics to ensure we continued our goal of local capacity building. And we provided as well printed materials and digital activities because depending on where we were working, the scenario is different. We assessed that the majority of teachers use WhatsApp to send activities to children and families, because families sometimes, even if they don't have a stable internet connection, with WhatsApp, they can use local phone lines. And despite challenges and local difficulties, we have had results in terms of family engagement and willingness to work with topics related to health, nutrition, and sustainability. These are some pictures of the trainings we developed. And now I also bring some photos of activities developed at home by the families with the input of teachers. In some of the places we have projects. And as you can see, there's a strong focus on gardening and nutrition, as we learned that a home garden can not only supply vegetables, but instigate children and families to eat healthier. This is an effort to address that figure we mentioned earlier, that 12% of the families currently don't have the resources to buy fresh foods. And I would like to conclude by saying that overweight and obesity cannot be addressed in isolation. It is necessary to develop alternatives that are engaging and multidimensional in order to address all the factors influencing these issues. With local stakeholder involvement and capacity building, the objective is to create a grassroots network of relationships between schools, health units, local leaders, and families, so they look for alternatives that suit their own local needs. The COVID-19 pandemic has evidenced that solutions to health, environmental, economic, social issues can only be addressed in a collective effort with successful and dedicated partnerships. As Professor Ellen addressed earlier this morning, let's not forget we're all fighting together. And the coming months and even years are crucial for governments, institutions, and civil society organizations to observe and intervene in order to avoid a possible increase of epidemic proportion on the rates of childhood obesity, undernutrition in children, which will bring about an even higher death rate due to non-communicable diseases in the future. So this is what we wanted to share. Dr. Joyce, if you want to add anything, or we're open to questions.
Yes, I just want to thank you. A beautiful presentation Gabriela has put together, and the education definitely is what will change the world in the future. You know, we all are bounded by education, and it perpasses, you know, it's entangled in all areas of life. So our stress is that education reaches the population, and we are struggling as they are in India and in other countries, on access to internet, and making sure that the communities are reached. Thank you, Gabriela, and thank you for the opportunity to present the study here at this conference. Yes, we are ready for questions.
Thank you, Gabriela and Dr. Joyce. Really informative presentation, Gabriela, you know, with interesting interventions and policy solutions. And not just in education, but obviously in online education, but also in health and in nutrition. So thank you for that. Do we have any questions?
Yes, thank you. It's very excellent presentation. I particularly got inspired when we think about children nutrition and how that is very central to their learning. And also that the role of NGOs is very important. And I wanted to find out how strong are your NGOs and capacitated to help you to have a strong voice?
Brazil has gone through a lot in this past 30 years. And we did have, with the prior governments, a more intense effort to give voice to the nonprofits. Unfortunately, right now we are not in a very good space, but our organization is almost 30 years old. So we have, during these years, really gotten into good partnerships with not only with the local governments, but with several companies and foundations, not only from Brazil, but from overseas. So that gives us a good starting point. But you are right, you know, the nonprofits should stay together more and have a louder voice, because the government cannot really supply all what the communities need. And so there's a strong need that the grassroots, that the nonprofits, along with the government and along with the companies, work together, as Gabriela said about the partnerships. Gabriela, please, would you like to
I
add?
just wanted to add to what you're saying, Joyce, that Professor Marbella, you're right. I think NGOs, it varies a lot between international nonprofits and local nonprofits. We still see that there's this gap that would need to empower and provide more resources and trainings to local NGOs, so they can, as you say, build on local capacities. It's a very unequal scenario, but I think as other institutions as well, you have that in higher education institutions as well. There's this difference, but the past years, nonprofits and NGOs have gained strength, and they have built networks to implement good projects, and we see on the ground good results.
Yes.
It's intense work,
Yeah,
but we see that one day we'll get there.
Yeah, what we can see is that this really big international nonprofits, sometimes a lot of the support that comes from the companies stay at a headquarters level, and not everything reaches the real community, the ones that really need it. And that's something that unfortunately there's not many transparency and tools for us to look into that and change it. But it's,
thank you.
We are all doing what we can.
Thank you.
Thank you very much for the question and for the answers as well. Okay, I actually have a question. It's regarding, you said your results and collecting those results. I just want to know, because I'm very much an advocate of a systematic approach to dealing with any policy challenge or issue. And what has been sort of the difficulty in getting the data? I know you spoke about it at the beginning of your presentation, and what were sort of the surprise outcomes with working, for example, with a civil society, because a lot of stakeholders do have conflicting, if you spoke about the local government, they do sometimes have conflicting sort of goals or aims. So getting that data, getting them on board, how did you overcome the challenges, and were there any good things to come out of it?
Yeah, that's a good question. We actually, when specifically for this one, it was a surprise to us, because this is one of the limitations, of course, is we're reaching the ones that were able to answer, because it was an online survey. So we send out to families that, but we're surprised to the responses as well. We had almost 1,500 families, and if we had extended the time, we might have had more, which I think is surprising, but still we don't reach those that weren't able to, respond in terms of internet. But on our daily work, as you said, the data we gather, the height and weight and anemia and all this that we develop in our programs, actually, when we show the governments, the work that we're doing in terms of public health, and how important it is, what is the current scenario? Because sometimes, well, most of the times, when we arrive in a town, we know that education and health don't talk so much, and other entities, local entities don't as well. And we try to bring them together and say, interventions for health education have to combine, the local health post, the school. So we actually gathered this data in partnership with the schools and the local governments. We have rarely encountered situations where we have demonstrated the data and they said, no, that's not correct, and we know that that's the reality. But really, most of the times when we collect the data and show, our work is really to, in the long term, as you're saying, have some interventions become public policies. As for example, for a few years, we have studied that iron deficiency anemia is a real issue in school-age children. And providing, iron supplementation is not an expensive solution. And we include that in our programs. And we've been saying that for a long time, that it could become a public policy in a few years to turn around this scenario. So I think, as we're pointing out, it's something that you have to, show the data, keep showing. And, well, in terms of challenges, we haven't encountered challenges in terms of demonstrating what we have found. Because we, from the start, have them on board, the schools, the teachers, the local health departments. I hope it answers. Joyce, if you want to add anything.
I think it's exactly it. Although at the federal level, there is they say that they should, for instance, supply iron sulfate for the children. At a local level, they decide they don't. So there is not a good conversation between local government and federal level. And that's something that impacts on the population. So what we have found that if we work closely with the local government, sometimes it is easier to get results because you are closer to them than at the government or at the federal level. Yeah.
Yes, absolutely, I agree. Lots of issues with sharing data and knowledge across different government bodies, and especially with the local community and the local government and then the national government. Thank you very much. Thank you for your interesting presentation and for answering our questions.
So please remember, if we all help and do a little bit, it will make a big difference.